My name is Professor Amanda Howe. I'm from the UK. I work in a medical school in Norwich called the University of East Anglia, and I'm also the President-elect of the World Organization of Family Doctors, which is known as WONCA. Family medicine is a branch of medicine that's been developing around the world for maybe 70 or 80 years, but in some countries it's much more mature than others. So, for example, a young doctor in the United Kingdom can choose to be a hospital physician, a family physician, a surgeon, or OBGYN, or a pediatrician, and all those disciplines have a postgraduate training with an exit exam, so they're all specialties. In other countries, family medicine is only just beginning to be developed, and sometimes it doesn't have a postgraduate training yet. But certainly we can say that in the world, family medicine is becoming much more common, much more important. In WONCA, we have many new member organizations representing family medicine, so I think it's getting stronger. Originally, I think the government could see that to have a doctor in every community who would be the first point of contact for most medical problems was wise. So when our NHS started, they allocated a contract to general practitioners. That's what it's called in the UK. And then over time, because so much work, so much important medical work was being done in that primary care, in the community setting, they developed more and more the discipline of family medicine, so that more doctors, now almost half the doctors in the NHS are family physicians working in quite big clinics with a good team, electronic records, good infrastructure. So we've seen over time in my country more and more investment in that community primary care team, and that's because actually most care can be done outside hospital most of the time, especially with new drugs, new technologies, lots of things we can do in my clinic. Patient never need to go to hospital, and it's convenient for them and it's good quality. So I think that's why family medicine is really being developed in the UK. So the World Organization of Family Doctors exists to enhance patients' care through the development of family medicine. So we share the experience of the discipline with new countries or new professional groups. We share curriculum, we share the standards for education for family doctors. We will network with each other, we have conferences, we develop and share educational resources. It's really a body that links up professional organizations of family medicine all around the world. And also we particularly encourage young doctors to think about joining our family medicine as a discipline through our young doctors movements. And finally, we advocate. So we are a non-governmental organization registered with the World Health Organization. That means that we are taken for discussion with WHO in all the regions around the world about how to strengthen healthcare systems and what is the role of family medicine in a good healthcare system. So advocacy, education, standards, and professional development, that's what we do. First of all, I would look at the evidence at why other countries are investing in family medicine. Even countries that never had it before now are interested. And if you look at WHO, the whole discussion is about doing things better, earlier, close to the people. So, if you develop diabetes, it's very important to know that you have diabetes before it seriously damages your health. If you have good, strong primary care with good medical supervision, that's the role of family doctors, it's likely that the team will quickly be able to check for diabetes with people who might be at risk and find it early. And so I think in India, if I was the minister, I would be looking at making primary care stronger, not just the family doctors, but also if nurses or healthcare workers. So increasing the resources and the quality of the clinical team in the community, so that people can use it, so they get good quality care, so that those teams have the right resources to do that job. Then I would also be saying, so that means we must train doctors who are working in those settings better. And that means developing a postgraduate specialty like family medicine. Already there's the Indian Academy of Family Physicians, but it's making sure that every medical school has some faculty of family medicine, and every district, every region has some presence to train family doctors and to use them for the community over time. And I would do that as the minister because I think it will save the government money, it will save the people suffering, it will improve the health outcomes for the people, and it will make sure that the hospital doctors also are not overwhelmed, because I understand in India that people are very, very, very busy. Everybody's going straight to hospital, and that can't really be very good for those colleagues either, where in my country, I do my job well, and it means that my colleagues in hospital can do their job well. First of all, the patients must believe that what the doctor is trying to do is going to be in the patient's best interest. So I think there's a big problem if the patient is worried that the doctor is only doing this for money. So I think one big challenge to us all is how to not make payment at the time of use of the service interfere with the doctor-patient relationship. So in my country, we don't get paid by the patient when they come to see us. We get paid in another way. And for me, that means that when I'm talking with the patient, they're not worrying, am I just doing it to make more money? They believe that I'm doing it because I think that will help them. Second thing you need to do to increase trust is to treat people with respect and to listen to their problems properly and really show that you want to understand what is worrying them and why, which is an interpersonal skill, but it's also a question of being the right kind of human being and professional. And so doctors who just don't listen, don't look at the patient, don't get the patient's views before they start to tell them what to do, they're not going to feel, patient isn't going to feel they're very trustworthy. Whereas if my doctor really seems interested in me and what's happening to me, that will help. Third thing is then doing the job properly. So doctor who examines properly, doctor who thinks about the right choice of drugs, doctor who follows up to make sure that treatment is being taken or tests have been carried out. Then the patient thinks, oh, this doctor is doing a good job. And when they talk with their friends, my doctor examined me properly. Well, that's good. Finally, I think also knowing that your doctor is trained properly. And in my country, we have a lot of governance. So you have to show that your practice is good, and you have to renew your license, and you have to show your exams. And all those things, I think, also protect the public. So some of it is about governance, about transparency, and some of it is about being trained to do the job properly. Of course, none of us can do our job well if we don't have the proper resources. So all the things I said earlier about having the right equipment and the clinic and the conditions also matter. But I think once a patient sees a good team and a good service, then a community will begin to really value that, and that trust develops over time. And providing you keep doing the job well, that trust becomes very strong. And that's one of the great things about being a family doctor, because you have that relationship with the person and they feel responsible to you and you feel responsible to them. And then you really do get a good trust that makes that relationship work really well. So we have a cycle of every 5 years in my country. Every year we have to make a portfolio to show how we're keeping up to date, how we're checking that our clinical service is good. But every 5 years there's a formal kind of renewal of your license. That hasn't existed for very long, but the idea is that the public then can know that it's not just that I took my exam 40 years ago, but that all the time I'm having to show that I'm still fit to practice for the service.